Casey LeBaron, and this is another edition of Hubcast Chelsea, or it's Chelsea Hubcast. Today, we're speaking with Dr. Amanda Leaf, who's the owner of Heal Veterinary Clinic in Watertown, and thank you for joining us. We also have our regular guest and my partner in crime, Laura Appleton, who is also our Chelsea Hubcats outreach volunteer. So thank you, Laura, for joining me today. Chelsea Hubcats is a nonprofit organization that was founded about 2 years ago to focus on the needs of cats within the city. We assist with free spay-neuter programs, vaccination, and microchipping clinics, and rescue for cats and dogs. To date, we have assisted more than 1,200 cats and dogs from Chelsea. For more information about our organization, you can go to www.hubcatschelsea.com or find us on Facebook and join the team to help make a difference for cats and dogs in Chelsea. Our phone number is 857-776-2287, and our email is hubcatschelsea@gmail.com. Please come and join us and help make a difference in the lives of cats and dogs in Chelsea. This is your hometown, and we're here to help you. On today's show, we'd like to focus on the work that Dr. Leaf is doing at her clinic. But first, Dr. Leaf, maybe you could share with us a little bit about your background and, why did you choose to become a veterinarian in the first place?
I think that there's some consistency with, I think every kid goes through a phase where they want to be a vet. And those of us who actually become vets just like single-mindedly never waver from that. So I caught a snake in the backyard when I was like 4. And I just really never changed my mind about what I wanted to do.
A snake?
Yeah.
A garden snake?
Yeah, garden snake. And then I actually got one for Christmas a couple of years later, and I had that one for a long time, and now I have a king snake. So yeah, I definitely have a thing for reptiles. So I grew up in northern Michigan, and I went to Michigan State for undergrad and grad vet school. And then I worked in a mixed animal practice, which means I saw dogs and cats, but also cows and horses. And we saw our own emergencies, and I did a lot of really interesting things in Pennsylvania for 5 years. And then I came out here for a shelter job that I worked at for 4 years, and then I worked in small animal private practice, and then got to the point where you see things long enough and you sort of go, I want to try this my way. Mm-hmm. And I had the opportunity to be able to start my own practice. So I did that. And we opened in September, so now I have a primarily small animal practice, but my background and just my personality and my own personal passion has a really strong shelter bent, so I do a lot of shelter work. I do a little bit of exotics work. I managed to...
Reptiles.
Yeah. Although recently my most common exotic has been guinea pigs. Okay. So I'm learning a lot about guinea pigs. And I managed to vaccinate goats at the Belmont rabies clinic last year. Wow. So I'll take any opportunity I can get to do a little bit of not just dogs and cats. It keeps life interesting for me. So
you had you said mixed, so yeah. Small and large, yeah. And large meaning
horses
cows.
And cows.
Okay.
Yeah, generally horses and cows. It was also a fairly rural area with a lot of access to specialty clinics. So we also worked with the local zoo. So I did, see a cougar once for a private owner, wow. And I got to suture up a tiger once, twice actually.
A private owner?
Yeah, so in Ohio there's very, very different rules on what animals you can own. And so this guy had bought 2 cougars actually at a local sale and brought them home as pets and had them declawed and had them neutered. And he came in, the cat actually came in because it had a cold, just like a run-of-the-mill upper respiratory disease. And she was actually purring so loud that I couldn't actually hear her lungs. So, yes, I have a picture of me with an 80-pound cougar somewhere.
Wow.
So,
in Ohio? Or in Pennsylvania?
I was right over the border, so yeah. We were only 5 miles from the Ohio border, so people from Ohio would come over to our clinic. So the cat lived in Ohio, but I was working in Pennsylvania. I was licensed in Ohio because on farm calls, we would drive over the border to see cattle and horses and goats and sheep and pigs and all of that good kind of stuff. So I did a lot of interesting things. It also was a really great place to learn because we didn't have the fantastic access we have around here to surgeons like your guest from last week. Where people can refer things. So I had a lot of people who were like, I can't drive 2 hours because it would take my entire day. I can't go in for an exam and then for a recheck and then for a surgery and all of these things. and they couldn't afford it. So we did a lot of things that practitioners around here would generally refer, because I just didn't have the access to doing that.
So you had to be creative.
Yeah, exactly. So my boss did a lot of fracture repairs, and I learned how to do amputations and enucleations and entropions and cherry eyes and all of those kinds of things that, cystotomies and perineal urethrostomies. And I had to learn how to do it, or, because the option was euthanasia because they can't go for referral, or I figured this out.
Right.
So I'd rather figure it out and give the animal an opportunity. And that's something, sort of an attitude that I still have. I definitely see around here, while I have great access to specialists, it doesn't necessarily mean people around here can go for the specialty care either. So trying to give those people who can't afford specialty care an opportunity for some kind of care, I also think is really important around here as well. So.
That was a conversation that we had in our last, episode, was sort of about the high cost of veterinary care.
Yeah.
And how, we may all passionately love our cats, or even, care about animals in general. And if there's a cat that's collapsed in our backyard, or if there's a cat that seems to have an upper respiratory infection, or any sort of compromising issue, we care about those animals. We want to help them, but we may not necessarily have the funds to be able to do that. And it sounds like you've sort of thought through your practice and made your practice sort of in a unique way, so that then you're able to potentially maybe help that community in a certain way.
Right. Yeah, that's something that I very consciously set up, both working, I know you had the Mass Animal Fund, Sherry?
Yep, Sherry.
On here a couple weeks ago. So I'm one of the providers to the Mass Animal Fund. I work with a number of different shelters. I try and set it up in a way that's both seamless communication-wise, and I try and work with shelters and set it up and have a conversation with them when I start working with them, so that I have a really good relationship with those shelters. As far as I find really simple little things, like you need to know who in that organization actually authorizes you to spend money.
Right.
And fosters sometimes will say, oh yeah, you can go ahead and do whatever, but they're not the person who actually can make that decision. So having a point person for communication, so that I'm not talking to a foster and a transporter and the person actually making decisions. I talk to one person, we make decisions together, they can go and talk to their fosters, I can talk to my staff. It keeps communication a little bit more clear. Mm-hmm. So I try and do some things like that make my work with shelters a little bit more smooth and seamless. But it's also something I feel really strongly about doing. So working with the shelters, I'm always happy to talk to owners. I feel like there's rarely a single way to treat an individual animal, and there often are a myriad of ways in between nothing and everything that you can do. So talking to owners and finding out what are your priorities monetarily, but sometimes it's not even just the money. Sometimes there are emotional aspects involved. One of my really early lessons in that was an owner that came in with a dog that had gotten into rat poison. And rat poison is very easily treatable. You give it a blood transfusion, you put it on vitamin K, and almost 100% your dog's going to be fine. And this was a relatively healthy, stable puppy who needed a blood transfusion, and he needed vitamin K, but he was going to be fine. And I could not convince the owner to treat him. And the owner just kept saying, is he going to be okay? Is there going to be long-term complications? Is there going to be, and just on and on and on. And I finally, after talking to him for long enough, what I found out is he had been recently diagnosed with cancer. And he's like, I can't handle anything else in my life that would have a long-term complication because I'm so sick myself. And I said, I never promise owners anything.
Right.
But I said, I promise you, if you let me treat your puppy, it won't have any long-term complications. But you have to talk to owners and find out, what is their history, what are their values, what are their ethics, so that you can help them make the right decisions for them. And that involves, giving them lots of options and giving them all of the range of options, but it also involves listening to them and finding out what are their priorities and what do they want out of that life with that animal, what do they want out of the lifestyle they lead, and also what are their financial resources as part of it.
Do you speak Spanish?
Do I speak Spanish? No,
Yeah,
I
okay.
don't. I wish I could.
Yeah. You sound like you're almost more of a counselor
than
a veterinarian.
yeah.
I mean, I feel like I've just gone through a therapy session.
I do spend a lot of time talking to my clients, and I think that I can provide better care because I do that. But it's also interesting, it's one of the sort of red flags for us as veterinarians, when people come in and they're like, I want to be a vet because I want to work with animals. And I'm like, even if you're working in a shelter, none of them come in without a human attached. So you really do need to enjoy working with owners and working with people in general too.
Right.
So.
One of the things that we were just talking about before the record button went on, we were talking about that you had participated in one of the Chelsea vaccination microchipping clinics. And at the end of this show, please stay on because we're going to show some pictures from the most recent one that we had back in May. And I'd like to say a thank you to Katie Rogers Art for those photos. So to stick with us for the end, and you'll see some great pictures from that event. But I was wondering if you could share a little bit about your experience in working in that clinic.
It was really fun. The sort of community atmosphere of all of the people that came together to be able to put it on, and the numbers of volunteers and staff that they had, from veterinarians to technicians to assistants to people running animals back and forth and providing water and setting up and taking down. And it was such a huge, well-organized effort. It was really fun to be a part of. It's also really interesting to examine fractious animals in a field. So
having a cat tent.
Yes.
They had a cat tent at the one that I was at, but then it became apparent as the day went on that the cats are slower because you have to coax them out and you have to handle them differently and you worry about them getting loose. So I was caught up. So they said, well, we could do another cat tent if we use the bathroom. So me and 2 staff members stuck a table over top of the toilet in the bathroom stall and saw cats in the bathroom. And then when we walked out, everybody else was gone because everybody else had finished and disappeared. It was really bizarre. But no, it was really, really fun to do. It was a great community effort. It was great to see the number of animals that got served. It's just great. You know, I used to see a lot of parvo in Pennsylvania, and I hate seeing parvo. So knowing all of those animals got vaccinated for things like parvovirus and distemper was just huge. So.
Yeah, it's been wonderful having the community bringing their cats and dogs.
Yeah.
And I've been always astonished with the numbers of cats. I mean, at all of our vaccination and microchipping clinics, we've had almost an equal number of cats to dogs. So it's like 100 cats and 100 dogs. Right. And I think that, you know, bringing a dog to an event is not anywhere near as challenging as bringing a cat to an event.
Yep. Exactly.
You know, so it's a testament to the Chelsea community and the fact that they really care about their cats and want to get them vaccinated. And that goes to another question. You know, a lot of people say, "Oh, well, you know, maybe there's cultural lack of interest in getting your cat spayed or neutered, or your dog spayed or neutered, or that kind of thing." But my sense is always, if you offer it, you know, at an affordable or a low price, and you promote it well enough, you know, the masses will come. But I don't know, do you have differing thoughts on that?
I do see that there's some people who either culturally or just personality, or, you know, I do get the guy who's like, yeah, I wouldn't do it to myself. Why would I do it to my dog? They definitely are people who just are not, they're scared of the anesthesia. I get people who are like, my last dog died under anesthesia. I don't want to do that to this one. Last time I had her out for something, she didn't recover well. So again, finding out what is it that they're worried about, and seeing if it is something that you can talk them through or give them a way around, or explain that, you know, that isn't likely to be the case. You know, an animal really just does not know if it has reproductive organs or not. You know, it might know for a day or two, but it's not going to know long term. Like, they don't have the attachment that we have. And they recover really differently. You know, I know human females who have had hysterectomies, and the recovery is very, very different than it is in a dog. Most of my dogs don't know anything happened a day or two later, whereas I know women who are really strong, like, I'll recover just fine, who really take 6 weeks off. And so if you understand why the owner's worried about it, if they're worried about it because they had a hysterectomy and they recovered poorly, you know, you can tell them this is really, really a different recovery for them.
And behaviorally, it's the benefits.
Yeah, definitely. And so if I get the opportunity to explain to people why I want them to spay or neuter them, it's also a really interesting world to be practicing in Pennsylvania, or in Massachusetts right now, because a lot of the reasons that we used to say spay and neuter, spay and neuter, spay and neuter was overpopulation, and that's actually not one of our primary concerns now, because we don't have as much of an issue with it. We don't have dogs running loose off leash, so they're not going to get pregnant because somebody else's dog is running or loose. So it's changed the conversation a lot to what's best for that individual animal, and there's still benefits with behavior, and there's still benefits with health to spaying and neutering. And there's benefits to spaying and neutering young when they're going to recover better than waiting until they're 10 and they're actually having a complication because they're intact. So I still think that there's huge amounts of benefits in it. But I really appreciate the opportunity to talk to individual owners about what are the benefits and what are your priorities.
So, but when you say that overpopulation isn't as much of an issue, you know
Yeah.
that.
Yeah.
Maybe I know that, but does the general public know that?
That it's not as much of an issue here?
Yeah.
Most
I mean,
of
I
them
would say I
don't.
could still use that as an issue with them.
You definitely can.
U.S.-wide.
Yeah, U.S.-wide, there's still issues.
Yeah, it's definitely an issue on like the whole population. When I say it's not as much of an issue here, people are often surprised. So I do still think that that's a factor to play into it. And I definitely let people know, like if you have an intact male dog, when I was in Pennsylvania, I could almost guarantee you the hit by car dogs were going to be intact males because they were the ones that run. So if you're going to have an intact male, there's a lot of responsibility on you to keep that dog under control so it doesn't go run and find the girls, because they can smell them for a long ways away and they will go find them and they don't care if there's a car in their way. So.
You made an interesting statement. I'm going to stay on this overpopulation question because you're very, very involved in helping community cats.
Yeah.
And there certainly is still a population of community
Yes,
cats
that is totally
out
true.
there on the streets. We have long lists of colonies of cats that need to be trapped in Chelsea, Revere, Everett, Lynn,
Brockton.
and Brockton, Brockton, and there are target areas around the state where there's a lot of work that needs to be done to help those community cats. So, we may not have as many challenges as we used to in a sheltering environment, but we have quite a few on the street. So how do we meld those two sort of situations sort of together so that we can work most efficiently and effectively?
The things like as I talk to people in the TNR, trap, neuter, return, so when you're really dealing with street cats that are not friendly and can't be adopted out into a home, that the things that I see them struggle with are finding people who actually can do the trapping and the transport, and finding veterinarians that will work with those cats. And I know that that was one of the things you mentioned as something that you wanted to talk about is I know working with the TNR groups that there's a deficit, especially in certain areas, of finding vets who are willing to see the TNR cats. Because it is a really different world than working with an owner that brings in their 6-month-old cat and you can go through everything and you can examine the cat and you can get consent for what you want to do and you can talk about the pros and cons. The TNR cats, there is none of that. I usually have somebody dropping off cats and I don't get to examine them because they won't let me examine them. And it's hard to predict whether or not somebody's actually going to be able to trap them. So, for a startup business, if I block off 3 spots for somebody to bring in TNR animals and then they can't catch them, and now I have that spot in my schedule that's not getting filled with anything, that's hard on a practice. And it's something that just is sort of par for the course when you're working with TNR. Like it's not like anybody's trying to slight me, but cats don't always cooperate with what you ask them to do.
Right.
So I see, scheduling is more difficult. The cost is definitely more difficult. Knowing that you wanted to ask about some of these things, I looked up if I do exactly the same procedure with exactly the same vaccines for a privately owned client versus one of the TNR groups that I work with, I get less than half of the money for the TNR that I do for an owned animal. And that's because I've heavily discounted my prices so that I can do that kind of work because I enjoy it and I know that there's need. But if the TNR group can know that they can go to a place, especially that has subsidized funding, like some of the big shelters do, they can keep their costs lower. And my costs are not as low as like the MSPCA or the ARL, but they're where I'm comfortable with the price and I'm not making it so that I'm not affordable for the TNR groups. But that definitely is, like if you have a business that's up and running and you know that you could schedule a private client, you're not at any deficit of finding those private clients. Like why wouldn't you schedule a private client and make twice the money?
Right.
So I think convincing people that it's beneficial, I think you need to find people who really have a passion for it. And or you need to find somebody who's looking to build their practice. Because for me, doing that has actually been a huge practice builder. Because yeah, the TNR cats aren't going to come back to me, but the people who bring the TNR cats usually have cats, and a lot of them now come to me. And people who do adopt the friendly cats do come to me. And so that network has been very, very big in getting my business up and off the ground. And it's something I'm passionate about. So even when my practice is really thriving, it's something that I'll continue to do.
Well, and in the past, when I've worked with veterinarians, if they've added a new doctor on their staff, the trap, neuter, return cats often would go to that new veterinarian, so then they would get their surgical practice.
Exactly. It's great. You know, there's not any difference in the quality of care that you want to provide those cats, but there definitely is a little bit less stress with knowing that there's not a 10-year-old girl waiting to come home and see her cat when she gets home from school when it's a TNR cat. So there's slightly less mental stress, even if the care is exactly the same, and the quality of the care and the amount of emotional and mental energy you put into that cat is exactly the same. It's just less stressful.
It's different. It is very, very different. For folks that are interested in finding out more about trap, neuter, return, in a previous episode, we interviewed Kit Lilly from Charles River Alley Cats, and she had a trap here with her and did a little demonstration. So if you want to go back to one of our previous shows, you certainly can learn everything that you would want to learn about how to trap a community cat and that kind of thing. But we're now talking about once the cat's in the trap and the cat, you know, arrives at the veterinary practice, or there also are free clinics that happen like once a month. There are about 2 or 3 different organizations that offer these clinics, and anybody is welcome to use those. And I think over the years, the number of cats that have been coming into those clinics has gone down, and I wonder whether it's fewer trappers, are we just getting older, or is it that there are fewer cats actually out there?
I would say to me, it seems like there's fewer cats out there. And if you look at the numbers from the MSPCA and the ARL that I've seen, at least, and I'm not directly involved with either of those organizations anymore, but the numbers I have either heard of or actually seen from them are that the numbers of cats that they're taking in has gone down steadily. And also then that means their number of euthanasias has gone down, and their ability to then provide more extensive care for the animals they do get has gone up. So it's allowed all of those organizations to do a lot more work for the cats that do come in, which has been fantastic. So I feel like, well, there are a ton of community cats out there, and there's definitely still a huge amount of need, that we're actually making a little bit of a dent. Like it's not totally uncommon for me as a private practitioner to have owners come in with a kitten, and when I always ask them, where'd you get your cat? Partly because I need to know medically, and partly because I'm curious. And over the last maybe 2 or 3 years, I'm getting more people coming in saying, I got him from a breeder, or I got him off of Craigslist. And I say, well, why did you go to one of those places? And they're like, because I can't find a kitten in a shelter.
Right.
And because there's not as many kittens available. I'm starting to see, it used to be that if cats were pregnant, we would still spay them. And I'm starting to see some organizations that with the right cat, with the right access to foster care, they're actually letting the cats have kittens, because they actually have the ability to adopt those kittens out now, and the general public wants that. And I think we're just starting to see what's happening in the dog world, where people are actually transporting cats from other states to fill the void of people wanting to adopt kittens.
What unique health risks come to mind if you take in a community cat?
If you take in a community cat from a shelter that's already vetted,
no.
Or you
From the
make a
street,
decision?
Good Samaritan, like a Good Samaritan.
Yeah, but cats are often abandoned, and they, for whatever reasons, but a friendly cat who is shy and has a feeder, so.
Yeah, and I do see people get those periodically. I think the sort of big ones to me are, you want to make sure you've treated for fleas and ticks. Feline leukemia and FIV are viruses that we do see, not super commonly, but we do see in the area. So if you have other cats especially, testing them for feline leukemia and FIV, making sure they're vaccinated, making sure they're healthy. Sometimes those cats have problems that they got. I honestly think some of them get dumped because they have medical issues. I saw one the other day that was dumped at a trailer park, and she had a really horrible inflammatory oral condition called stomatitis. And so she needed pretty much all of her teeth removed. And it was really interesting because the day that I took her teeth out, she was more friendly in the afternoon.
Oh, I'm sure.
Because I think she was just
There's no
that
pain.
uncomfortable. And she turned out to be a really, really nice cat. But I think sometimes those animals might get dumped because the owner realizes that they need medical care that they can't provide. And so they would rather dump them and hope somebody else takes them.
I'm going to ask you a question that I have gotten a lot over the years, which is the ear tip.
Yeah.
And, you know, oh, you cut off, the veterinarian cut off half the cat's ear, or isn't the cat feeling a ton of pain having this ear tip? Can you tell us how do you ear tip, and a little bit behind like the size and the why and all that?
Yeah, so I think there's a couple parts. I feel pretty strongly about that. Like, to me, an ear tip, which is done so that a trapper or a veterinarian or whoever's working with a colony can see from across the parking lot, is how I like to say it, or across the field or whatever, that that cat has been spayed or neutered. And it doesn't function if you can't tell that the cat's ear tipped. So to me, a small ear tip is not, it doesn't achieve the purpose that you want it to achieve. The idea is that you should be able to see that cat from a distance and have absolutely no question that that cat is spayed or neutered, and you don't need to trap it.
Take scissors?
I take a hemostat, which is like a clamp, and I clamp the ear so then it keeps it from bleeding, and I cut the ear off above that, and then I take a silver nitrate stick and I cauterize the blood vessels, and I leave that on for a minute or two until it clots, and then I'll take it off. I'm sure it's not the most comfortable thing in the world, but these are all animals that are getting spayed or neutered at the same time. They're all getting pain medications. I just took their testicles out. I don't really worry too much that the ear is actually more uncomfortable than the surgery they were actually there to have. So I'm providing pain control. The animal's asleep when it happens. It's already having a different surgery. And to me, the other thing that I see is I'm the one who has to deal with the cats that come in and they get trapped and they're stressed in the trap. They get transported. They're kept in somebody's house. They're scared. They come in. I anesthetize them, and then I find out they're spayed or neutered. And I feel like that's a way more stressful thing than having a small portion of their ear cut off. And I did that the other day. Like, the other thing that I really wish everybody would do, and I'm seeing a lot of shelters do, is tattoo them. So that if I do sedate a cat, I shave its belly, and then I can see the tattoo on their belly, and I know that that animal's spayed.
Right.
And that's also huge, because that cat that I just described, where I took out all of the teeth, I then went on to spay her, only to find out she'd been spayed. So she just went through a 2.5-hour dental, and then she went through a much longer spay procedure than she normally would have, because it takes me a lot longer to verify that animal's actually been spayed than it would to actually spay them. So yeah, it's a bummer when you anesthetize an animal and put it through an unnecessary procedure and an unnecessary anesthetic procedure or surgical procedure when you could have done something as simple as ear tip it.
And it's a likely outcome because of abandonment.
Right.
You know, so if you abandon an animal, you have no ear tip because it was once owned.
Right, exactly. Because I wouldn't, if I have an owned cat that's friendly, I don't ear tip those. Because theoretically that owner is going to keep that animal, or it's going to stay friendly where you can actually examine it and you can shave it for a tattoo while it's awake. And it's not, you know, a friendly animal or an owned animal isn't going to be, hopefully, this isn't totally true, as scared of being in a cage and brought to the vet and have a set of clippers run over its belly, like one quick swipe with a pair of clippers and you can see a spay tattoo or a spay scar sometimes.
Right, and you'll also scan for a microchip, which that's one of the reasons why it was so important. Many people ask us, well, why do you offer free microchipping you know, at these clinics? Because so many rabies vaccination clinics or, you know, vaccine clinics are just about the vaccines.
Right.
And they're not including the microchipping. And we felt while we were dealing with such a small target area, being in Chelsea, it was very important to our animal control officer that we offer microchipping, because then we wouldn't make the mistake of an owned cat, you know, being ear tipped.
Right. Yeah, and I think that's a great way, because then I can, it doesn't allow me access to the history, but it allows me to find out where the animal came from. So I'm less likely to try and spay and neuter that animal again. And then I also see, you know, I've had it work really beautifully many times in my career where somebody brings in a stray or brings in an animal that they found, or I've had animal control bring me in animals that get hit by a car. And I'm trying to decide, what should I do with this animal? Is this animal have an owner that's willing to pay for the care that it needs? Or is this animal something that's suffering, then I should euthanize? And if it has a microchip and I can find the owner and actually ask that, it makes a really big difference in what gets to happen to that cat.
Being that it's the middle of the summer here,
Yeah.
I'm going to ask you about flea collars.
Yeah.
What are your thoughts?
It depends on the flea collar. Up until very recently, I would have said absolutely no to a flea collar, but that was because there weren't good ones out there. If for dogs, there are now two really effective flea and tick collars, Scalibor and Seresto. Scalibor is good for 6 months and Seresto is good for 8 months. Seresto, I believe, also makes a collar for cats. Those collars, they don't smell bad. I hate the smell of flea and tick collars, and they actually work. So those I'm actually a really big fan of. They are cheaper, they last longer. Every medication that you use is going to have a little bit of a ramp up and a little bit of a wane on the end of its effective period. But when you're dealing with 6 months, you've got like a really solid 5.5 months of prevention. So I would, both from a cost-effective perspective and from a like length of quality control, I think that's also really good. And it also, because they get into the layers of the skin, they have a little bit of a repellent effect where the flea or tick might just be on that animal and it might die just because of the contact, versus the orals that are out there now, they actually have to bite to be exposed to the insecticide and to have them die. So I recommend the collars to pretty much everybody. There are also really good topicals out there. Brevecto I sell a lot of for dogs because I get a lot of owners who don't want a flea or tick product on their animal where they're going to come in contact with it or their kids are going to come in contact with it. I get a lot of dogs.
I mean, I have done the parting of the fur and the putting the goo down the back.
And I get a lot of animals who sleep in bed with their owners or they sleep in bed with their kids and they just don't want those topical medications on the dog, so they prefer the orals. Brevecto comes as a topical for cats, and it's a really effective flea and tick medication, and it's good for 12 weeks. So I like that. It is definitely more expensive than some of the other options, but that's a good one. Revolution is great because heartworm also exists in cats. So not only is the Revolution going to prevent fleas and some ticks, it'll also prevent heartworm and it'll also prevent ear mites. So that's a great product. Frontline is definitely still out there. I think there's some question as to whether or not there's starting to be some resistance to Frontline. So, I mean, it's a constantly evolving world, and everything will change with time. Like when I was practicing 10 years ago, the only thing that was out there was topicals. And now there are actually effective collars and there's orals, which is something that we never thought about having at all. So it's a definitely constantly evolving world, and you also get different preferences from different vets about what the best product is, differences in what they carry. But yeah, with cats, thinking about fleas and ticks and heartworm and ear mites is all a really important thing to think about, especially if you have a cat that goes inside outside.
Capstar.
Capstar is great.
Yeah.
I use Capstar a lot. The downside of Capstar is that it kills all of the adult fleas.
Yeah.
80% of the flea's life cycle is not an adult flea. So you have 80% of the life cycle is not killing.
Yeah, you need to supplement.
Yeah, you need to use it in conjunction with something that will actually kill the other stages of the flea's life cycle. And fleas especially, not only does 80% of the flea's life cycle not an adult flea, it also means 80% of the flea's life cycle is not on your cat. So what you need to do is prevent the eggs turning into larvae and then turning into adults that can then bite your animal. If your animal's prevented, it has to go from an egg to a larva to an adult flea. It has to get a blood meal to be able to lay eggs. And if you can prevent your animal from being that blood source, then it can't complete its life cycle. So having it, Capstar I use all the time because I get especially TNR cats coming in and they have fleas, and the last thing I want is fleas jumping on my incision. So I will give a lot of them Capstar. But I also know that Capstar will kill those fleas and it's not going to actually prevent that long term. So I use it as in conjunction with other things.
Most of these products, though, aren't like available like in the grocery store or something like that. I mean,
usually not. So if you talk to the companies that make them, with the exception of Frontline and the generics that are off of it, you can find that over the counter in pet stores now. You still probably not going to find it in the grocery store. You do want to be careful with cats. Some of the dog medications are actually toxic to cats. Some of the flea medications available over the counter do have a very high rate of being toxic to cats and causing neurologic side effects, so you do want to be careful with what you're using. Places like Scalibor and Seresto will say they don't sell to places like Amazon. You can find those products on Amazon, but there's definitely a question about where those products came sourced from. If you buy them from your vet, they're going to have a money-back guarantee on them, they're going to have a quality control, and they're going to have an effectiveness guarantee on them, and the companies will back them. And I've had really big companies like Marielle be great at actually backing their product if I think that there was a reaction to it. I had a dog with a Scalibor collar that went to daycare, and another dog grabbed its collar and broke it, and they replaced it for free. So I've had really good backings from multiples of those companies if they're bought from a vet, because that's who they're selling to. If you buy them online, there's definitely some counterfeiting from different sources. So you want to be careful that you're getting it from a reputable source. And there's a difference in whether or not the company's going to back it depending on where you buy it from.
So I'm going to say buyer beware of anything that you see in a grocery store.
Yep.
And
I would agree.
then I would say, even though you might think it's the cheaper alternative, the long-term risks are not worth it. And what about kittens?
Oh, kittens are really frustrating, quite honestly. There's not that much that's labeled in really small kittens.
I mean, they're like flea magnets.
Yeah.
They say, jump on me, please. I like to play.
In a shelter environment, there's a couple of things that we'll do to try and basically dose down the products that are available so that they're appropriate in size. But as far as something that's commercially available to a private owner, it can be really difficult. And I do with private clients, I do a lot of make sure your animal's just not in a flea infested environment to start with, because it doesn't get fleas. Make sure the mom's actually prevented against getting fleas and ticks. And I do a lot of combing and bathing, honestly.
Bathing with what?
Just like water, wet comb and water. You do need to be really careful. You don't want to you need to be really careful with actually bathing a tiny neonate, because you can get them too cold.
Right.
But if you have, if you find a kitten outside and it really is covered in fleas and ticks, I use a lot of Dawn dish soap and water, and doing that and combing them out and then putting them in a non-flea infested environment can actually be really helpful. It's not going to be your be-all, end-all, but you can certainly do that, and then talk to a veterinarian about, what do they have that you could actually dose down or use safely in a kitten of that age.
What are your thoughts on, I'm going to change the topic unless you have more flea, tick, and parasite conversation.
Maybe. I was thinking about, you had mentioned parvo. I don't know if you have incidents in Massachusetts as well, and the predominance of the disease.
It's not anywhere near as common here as it is in other areas of the country, in large part because it's really easily prevented with vaccines, and most people have their dogs vaccinated, at least with an initial puppy series. So there are pockets of it, and the pockets tend to be in areas that there are unvaccinated dogs. I know, you guys might know better than me, I know out in Springfield they had a parvo outbreak a couple years ago.
Yeah.
But it's a virus that's really, really persistent in the environment. So you basically should just assume that it's out there. Because once an animal has parvo in that area, that virus stays for a really long time. So I would say
what gets rid of it? Excuse me.
Bleach.
Bleach. Okay.
Yeah. Bleach will kill it, and physical removal. But you can't bleach your lawn, and it's transmitted in feces. So you just can't get rid of it in the environment. I can bleach my floors, but I can't bleach my couch, and I can't bleach, I can throw out dog beds, but I'm not going to necessarily throw out my carpet that the dog had diarrhea on. And you can't necessarily bleach your carpet. So I tell people if they have a dog that dies of or is treated for and successfully survives parvo, that they should only bring dogs into that house that are already vaccinated.
Mm-hmm. And I was thinking about kittens, and many people say, the mama is too far along, and I'll go let her have her kittens. And frequently she returns with the kittens, but the kittens, 8 weeks, the kittens could be saved. In terms of socialization, 12 weeks, maybe. 16 weeks, it's time to call the ACO, because it's cats, young adults. You have any feeling about this in terms of,
About the socialization or what ages?
yeah,
or?
ages, in terms of if you see a pregnant mama,
Yeah.
what is the right time?
Outdoors.
Yeah, that's a
And
really tough one.
kittens, and you don't want to get them too early, and you don't want to get them too late, and there's this window of opportunity, but
Yeah, and that's a really tough one. And I think it probably also depends on what organization you can work with and what resources they have. Because certainly if you have, if the mom actually turns out to be friendly, that would be your ideal scenario, is take her inside and then socialize the kittens after she has them. So I guess that would be the first question. If the mom's truly feral, though, then yeah, you do want to take the kittens away young enough that you can still socialize them, which maybe I'm not as into behavior, but I'm guessing for at least under 8 weeks and probably over 4 weeks is probably your primary window. But at 4 weeks old, they also should not be away from their mom. They shouldn't be out of a litter. Bottle feeding babies, singletons especially, are notorious for being the brattiest cats because they didn't learn how to be a cat because they didn't have litter mates around them. So you definitely want to keep them with the litter, but you also have to have somebody who's capable of taking care of a 4-week-old kitten without a dam around because the queen is really, really important to them. So yeah, I think it depends on if you have access to somebody who can actually care for kittens that young, and if you don't, do you wait until they're 6 weeks old and then take the kittens away from the mom? Because then you're kind of it's going to get a little bit harder to socialize, but you're also a little bit less likely to end up with medical or behavioral social issues because you waited too long or because you took them away too early. So I would say it really should be done in conjunction with a group that can help with the resources of what you should do. So if you see a pregnant mom outside, start talking to your animal control officer, find out who does TNR in your area, find out what their resources are, and find out, what can they talk you through, what can you do for that cat and that kitten, that group of kittens. And I think the answer is probably going to vary a little bit depending on the resources. Certainly if it's, if the area is overwhelmed with kittens, it might not be the worst thing to trap that mom and spay her while she's pregnant. Because if you're going to have a hard time adopting out kittens, or you're going to have a hard time with adopting out other cats because those kittens are going to take up the homes that could be used for the adult cats in the area, there's sort of a domino effect to it. Yes, you could probably adopt out the kittens and that's not a big deal, but does that mean some adult cat is not going to get a home because you did that? So maybe is it actually the worst thing to spay that cat? And it's an ethical decision that everybody has a slightly different answer to. And like I said, the answer is changing around here.
Feral cats, pregnant feral cats, I've had scenarios, where they've had the kittens outside, they've gone into foster care, and they've had kittens in a, it's very challenging.
It is, and I definitely have seen shelter groups and rescue groups struggle with, if you take, because some people want to take the feral in and then keep her inside, but then if you keep her inside until she has her kittens, and then you keep her until the kittens are able to be weaned, yeah, you might end up with more social kittens, but is that really an ethical thing to do to that mom cat? To really keep her from not running and hiding and never seeing her and actually being able to socialize the kittens, you have to keep her in a cage. So now you have a cat that has to live in, sort of the best case scenario is a hospital cage with a divider in it where you can shoo her to one side so you can clean this side so you can socialize the kittens, and then you can reverse it.
Very challenging.
I have a hard time saying that that's actually an ethical thing to do to a mom cat, depending on how scared she is and how far along she is. And
alternative is, the wild and, raccoons and.
Right. I mean, there
I have
risks
some friends who are raccoons, but,
Yeah.
Yeah, and so, there's a lot of things that play into it. And so I think your answer is going to depend a lot on what your resources are in the area.
Yeah, I found it fascinating. The kitten lady, Hannah Shaw, who is all over Instagram and everything. She's a friend of mine, and she's known for bottle babies. That's her specialty. But she recently took a feral mom in with kittens and is fostering them. And I really want to follow the path of what she's learning in that process, because she's normally without moms dealing with her kittens. And I thought it was interesting she chose to sort of take this as a sample group, because she always is sharing what she learns in the process and her challenges. And I think it's an interesting dynamic, and it's a conversation that we're going to continue to have more of.
Yeah, definitely.
You know. So before we go into our announcements and talking about what's been going on with Hubcats Chelsea and all that, one last topic I want to just touch on quickly is declawing. Do you see that happening less, the same, more?
It's really interesting. I've moved across the country. So I started in Michigan and I worked in Pennsylvania and then I came out here. I see it as an incredibly regional procedure.
Interesting.
I have seen cats in Boston that are declawed. I don't know a single practitioner in Boston that declaws cats or in the greater Boston area. So I think out here it is an incredibly uncommon procedure. That said, when I graduated 15 years ago and I took my first job in Pennsylvania, I said, how do you feel about declawing cats? And they said, if you don't declaw cats, you can't have this job. In the Midwest, it is significantly more common. And one of my more interesting sort of personal surveys that I don't have written down anywhere is if I see a declawed cat come in, I ask people where they got it and where they used to live. And probably 75% of them came from the Midwest. So, you know, Michigan, Wisconsin, Pennsylvania, Illinois, I see a lot more cats coming from those states that are declawed. And I think that it probably used to be that way in Massachusetts too, that a lot of people declawed cats, and it's changing. But I think it's changing, it's sort of working from the coast, like in California, there's a lot of places where it's illegal. In Massachusetts, it's really, really uncommon. And I think that that's going to trickle more toward the center of the country, but I don't think that it hasn't changed as quickly in all areas of the country as it has in some areas. So I see it as something that is being done less. I think there are more practitioners that are object to doing it. There's more practitioners object to ear cropping and tail docking and all of those elective procedures. I was unusual 15 years ago in Pennsylvania that I would talk to people at kitten visits and say, why don't you give your cat an appropriate thing to claw on? Why don't you teach it to not claw on things that you don't want it to claw on? Why don't you try using soft claws? And then when you come in for your spay at 6 months, if you're not having problems, I'd prefer to not declaw your cat. And I had owners that would do that and wouldn't declaw their cats. But it also is just sort of standard. Like when I got my last cat when I was in, or one of my cats when I was in like 9th grade, there wasn't any question. You brought your cat in at 6 months for its neuter and declaw, period. And so I don't do it anymore. I have done it. I definitely, if anybody's ever considering it, I really strongly am object to doing it in adult cats because I see more problems with it because they're heavier cats, and so they're more likely to have problems with it. If you're going to do it really young. But I also don't think you're going to be hard pressed to find anybody in this area that would do it.
And there's so many other options at this point in time. But and it's interesting that you're, you know, in your scientific survey that, you know, you're seeing that they're sort of, the animals are sourcing from outside of the area. And I would hope in general we would just sort of start seeing fewer and fewer.
I think it'll happen. I think it's more talked about in vet schools. You're getting a lot more vets who are object to it. So I think that those areas will also change because people are becoming more aware that it's an elective procedure. And I think we're also graduating a lot more students that are not going to be willing to do it. So I think it'll change there too. But yeah, it's kind of interesting to see that it's really regional. And so I try and encourage people, don't be hugely judgmental because somebody might have come from an area where that was just the standard and they've never really asked the question about whether or not it needed to be done.
So at this point we'll turn to just an update and announcements of some of the things going on with Hubcats Chelsea. We have our meeting, which is usually the second Tuesday of every month, and everybody is invited to join us. It's at the Chelsea Police Department. You know, we've been busy working with lots of trappers. We had this great successful clinic on May 6th with over 240 cats and dogs. And please stay until the end and check out Katie Rogers' photos of the clinic so that you can see what a great day that was. Laura, our next clinic, I believe, is in October. Yeah. I think the date, it was October 21st, I think is the date. And anything else that you can think of that we're doing at Hubcats Chelsea you'd like to share with our audience today?
We need volunteers. We have community meetings at the police station monthly.
Donations of linens, cat food, dog food, fundraising volunteers, donations of gift cards, gift certificates. We're going to have a holiday auction. So if anybody has any connections with any local businesses or would like to solicit donations, please don't hesitate to reach out to us at hubcatschelsea@gmail.com or give us a call at 857-776-2287. And keep an eye on hubcatschelsea.com. We're actually going to start doing a little bit better job keeping our website up to date. Laura's getting involved with doing some work on helping put together a resource page.
Yes.
And we have some other folks. So, you know, as we all have, you know, Dr. Leaf also, she's got a website that she has to maintain in addition to everything else that you do. And the thing that I think is so important about our conversation we had today too is that, you know, you are a business.
Yeah.
You know, many people forget that you're a veterinarian, and you know, and they forget about that with shelters too. They're like, oh, aren't you funded by the state and all that other stuff? And you know, you are a small business just trying to pay the rent and pay the salaries and all that stuff too. And so we have to be respectful of that.
Yeah, and I think that's the thing that you know, most small businesses do, the owners don't get to actually profit from the business for quite a while when you start a business. So my priority is paying my staff and paying my mortgage. You know, I found a great building that has parking, which especially people who are driving to drop off feral cats really appreciate being able to park behind it, but that doesn't come at any small cost to me to be able to buy a building like that. So yeah, there's a lot of money that goes into running a business that I wasn't aware of until I owned one.
If folks are interested in finding out more about your practice, how would they reach out to you?
Our Facebook page is not as active as I'd like it to be. Hopefully I'll get more staff who are involved in keeping my Facebook page active, but I have a Facebook page that I've had since I first started my practice, and well, before actually, to sort of get the hype up about having it open. We have a really beautiful web page. It's not as up to date as it could be, but it's pretty close. So that's at heal.vet. There's no .com involved, it's just heal.vet. You can certainly call us. You can stop by. We really work to have really friendly receptionists. And so hopefully if we're not super swamped, receptionists can sort of introduce you to the practice a little bit and tell you a little bit about what we do. We certainly appreciate phone calls. We'd love it if people make appointments and come in. We do, if you sort of want to get to know us a little bit, we'll sometimes, if you have a nervous dog, even do what we call happy part 1 and happy part 2, and sort of split the initial visits that your dog can come in and meet us and see, make them more comfortable, sort of go over their history without doing anything like vaccines or blood draws, so that hopefully they have a really good first experience.
Is your address?
Our address is 150 Belmont Street. It's right by the Mount Auburn Cemetery on Belmont Street.
And that's in Watertown.
And it's in Watertown. It's interestingly Watertown on one side of the street and Belmont on the other side of the street. So
in Cambridge, not far.
No, it's not. It's right by Sofra Bakery, which a lot of people recognize as a landmark.
And the phone number is?
617-932-5166.
Fantastic. Excellent. So I want to thank Dr. Leaf for joining us today. Really appreciate it. Laura, thank you so much for joining us today too. It's always a pleasure. And thank you again for helping to make this show happen. And just a reminder to folks to donate to Hubcats Chelsea. Please go to our website at www.hubcatschelsea.com. Send us an email too. We're always happy to chat. And I want to just thank everybody for joining us today. Please stay for a few extra minutes and you'll see those photos by Katie Rogers Art. But I want to thank you so much, and we'll see you next time. And please remember that no cat or dog will be left behind in Chelsea. Take care.